Mastitis, one of the most costly diseases in dairy farming, not only affects milk quality and yield, but also burdens your herd's health and your pocket. But did you know that accurate diagnosis starts right in your hands with how you take that first milk sample? A proper sterile milk sampling technique is your most powerful tool to identify the culprit bacteria and determine the exact antibiotics needed, if any. One small mistake in the sampling process could lead to contamination, false results, and unnecessary treatments. That's why it's critical to get it right the first time. Let's walk through the gold standard method based on globally accepted veterinary procedures to ensure your sample truly represents the milk inside the udder, not the bugs on the outside. First, preparation is key. Wash your hands thoroughly and wear clean, disposable gloves. Label sterile sample tubes in advance, including cow ID, quarter, date, and time. Have ready 70% alcohol swabs or alcohol spray, sterile sample vials, a cooler box with ice packs if transporting, clean paper towels, and choose cows showing signs of clinical mastitis or high SCCs from herd testing before administering any antibiotic treatment. Next, don't skip the details when cleaning the udder. Wash the udder and teats using clean water and dry each teat with a separate disposable towel. Disinfect teats using 70% alcohol swabs, starting from the farthest to nearest teat. Pay special attention to the teat orifice. Wipe in a circular motion for at least 10 to 15 seconds and let air dry. Then, discard the first few streams of milk. This helps clear out contaminants from the teat canal. Begin collecting from the nearest teat first, in the opposite order of disinfection. Open the sterile tube carefully. Don't touch the inside of the lid or container. Hold the tube at a 45-degree angle, away from dirt and dust. Milk directly into the tube without touching the teat end to the container. Collect 2 to 5 ml of milk and close the tube immediately. After that, place the sample in a cool box or fridge immediately. If the lab cannot process it within 24 hours, freeze the sample. Note, Mycoplasma spp may not survive freezing. Never leave samples at room temperature. Finally, each sample must be labeled clearly with cow ID, quarter sampled, date and time, clinical notes, e.g. swelling, milk clots, and treatment history, if any. By taking just a few minutes to collect a clean, sterile milk sample, you can save days of uncertainty, reduce antibiotic misuse, and help build a healthier, high-performing herd. This isn't just a veterinarian job. It's a crucial part of progressive, smart dairying that every dairy farmer and technician can master. So the next time a cow shows signs of mastitis, remember, sample smart, treat right, milk bright.